I'm Joan. I'm a physical therapist at the Beth Deaconess Medical Center, and I'd like to talk to you about physical activity after your cardiac surgery. Being active will help your overall recovery, but remember, recovery will take time and patience. Judge your progress week by week rather than day by day. Most likely you will have good days and bad days. Your family needs to know that too. Here are a few key points to remember. Always protect your breastbone. For the first 10 weeks after surgery, avoid lifting, pulling, pushing, or carrying anything that weighs more than 10 pounds. For reference, a full gallon of milk weighs about 7 pounds. Avoid walking a dog. The tug on the leash could strain your breastbone. Avoid driving and sit in the back seat when riding in the car for the first 4 weeks after surgery. Taking this precaution helps prevent serious injury to your breastbone if the car's airbag were to deploy. Always wear a seatbelt using both the lap and shoulder strap, putting the pillow in between your chest and the strap for added comfort and protection. When you have your follow-up visit, your surgeon will advise you when you can resume driving. Get back to your routine gradually. During the first 10 weeks after surgery, you may resume light household chores and hobbies. When it comes to sleeping, some patients find that sleeping sitting up in a recliner is more comfortable for the first few days. When sleeping in bed, you can sleep in whatever position you find most comfortable, including on your side. Patients often have questions about resuming sexual activity. Generally speaking, you can resume sexual activity whenever you feel ready, and you'll want to limit the strain on your upper extremities for the first month or two. Walking should be your primary exercise. Your physical therapist will provide you with your specific exercise program prior to discharge from the hospital. Avoid extreme weather. Avoid exercise if you're feeling sick or overtired. Adjust your routine on a day-to-day basis as you feel comfortable and don't overdo it. Balance your activity with periodic rest periods and always know when to stop. There are things you'll want to consider before going back to work. If you have a sedentary type of job, we generally recommend that you go back to work within 5 to 6 weeks. Minimize any work-related activities before that time. If your job involves a physical activity, lifting, pulling, pushing, you'll want to wait a full 10 weeks before you consider resuming those activities. Take extra precautions to avoid getting sick. It's important to take care of your immune system, which is actively working to help your body heal. Avoid close contact with anyone who has had a cold or flu for the first 1 to 2 weeks. Take extra care to wash your hands and avoid accidental cuts or bleeding if you're taking a blood thinning medication such as Coumadin.